Good morning, ma'am. Good morning, classmate. So this is our case study presentation and I'm with Ayla Maris Reyes. Urinary tract infection. So what is the urinary tract infection or UTI? So for the anatomy and physiology, the urinary tract is the body system for getting rid of extra water and waste. So yung urinary tract daw ng body system natin is yung nag-aalis ng mga extra water and dumi sa ating katawan. It includes two kidneys, two ureters, a bladder, and urethra. Blood flows through the kidneys, which filters out the waste and extra water, making urine. So yun nga, yung blood daw natin is nadaloy papunta sa kidney natin, which filters or sinasala niya yung mga dumi and ekstrang mga tubig sa katawan natin na nagiging dahilan ng or yung ihi na nga yun. The urine flows from the kidneys to the bladder through the ureters. So yung ihi na nasala is dadaloy siya papuntang kidney and pupunta sa bladder and pupunta din sa ureter. So the bladder fills with urine until it is full enough to signal the need to urinate. So ibig sabihin nun yung bladder daw natin is pag napuno na, ibig sabihin nun magsisignal siya kung yung tao is makaihi na or iihi na. The normal urine flow usually washes away the germs called bacteria that cause the urinary tract infection. So yun nga, yung normal urine flow daw is yung nagwawash daw ng mga germs na tinatawag nating bacteria na nagkokos ng UTI. So a UTI occurs when bacteria do not get washed away and instead get into the bladder or kidneys. So kaya tayo nagkakaroon ng UTI because yun nga, yung bacteria is hindi siya naalis and instead pupunta siya sa bladder and kidneys natin na kaya nagkakaroon ng UTI. The case background, a urinary tract infection or the UTI is an infection from microbes. These are organisms that are too small to be seen without a microscope. Most UTIs are caused by bacteria, but some are caused by fungi and in rare cases by viruses. UTIs are among the most common infections in humans. So yun nga, yung urinary tract infection or yung UTI is caused by bacteria, pero yung iba din naman is caused by a fungi and in rare cases like yung mga viruses. So UTI yung pinaka-common na disease or infection meron yung mga tao. So an infection can happen in different parts of your urinary tract. So each type has a different name based on where it is. We have the cystitis or the bladder. You might feel like you need to pee a lot or it might hurt when you pee. You might also have lower belly pain and cloudy or bloody urine. Next, we have pyelonephritis or the kidneys. This can cause fever, chills, nausea, vomiting, and pain in your upper back or side. Next, we have urethritis or the urethra. This can cause a discharge and burning when you pee. So next, UTIs are a key reason why doctors tell women to wipe from front to back after using the bathroom. The urethra, the tube that takes pee from the bladder to the outside of the body, is close to the anus. So yung mga doktor po sinasabi nila or ang rasyonale bakit ang mga babae is pagkatapos umihi is ang pagpupunas is from front to back is because nga pwede siyang mag-cause ng UTI sa mga babae. Rasyonale po, mas small or mas shorter yung urethra ng mga babae kaysa sa mga lalaki, kaya mas madali para dun sa mga bakterya na yun na magpunta or pumasok from rectum back into the body. Kaya kaya nire-recommend na ang pagwa-wipe after umihi is from front to back. So next, bacteria from the large intestine, such as E. coli, can sometimes get out of your anus and into your urethra. From there, they can travel up to your bladder, and if the infection isn't treated, can continue on to infect your kidneys. Yung E. coli po is a bacteria na natatagpuan in the lower intestine of warm-blooded organism. For the risk factors, women have shorter urethras than men. That makes it easier for bacteria to get to their bladders. Having sex also can introduce bacteria into your urinary tract. Next, some women are more likely to get UTIs because of their genes. The shape of their urinary tracts makes other more likely to be infected. So, yung shape po ng urinary tract ng female is a narrow shape. Next also, women with diabetes may be at higher risk because their weakened immune systems make them less able to fight off infections. Other conditions that can boost your risk include hormone changes, multiple sclerosis, and anything that affects urine flow, such as kidney stone, a stroke, and a spinal cord injury. The urinary tract infection in pediatrics. Urinary tract infection or UTI is one of the most common pediatric infections. It distresses the child, concerns the parents, and may cause permanent kidney damage. Occurrences of a first-time symptomatic UTI are highest in boys and girls during the first year of life and markedly decrease after that. Yung UTI daw is yung most common na pediatric infections. Yung UTI daw, pwede daw siya mag-cause ng permanent na kidney damage dun sa mga bata. Also, first time symptomatic ng UTI yung highest in boys and girls during the first year of life. Pero after naman daw nun is nagde-decrease din. Urinary tract infection which are not caused by anatomical abnormalities occurs most frequently in children between the ages of 2 and 6 years. UTIs occur more often in girls than in boys and are often caused by bacteria found in stool. So, yung ganun nga, katulad dun sa sinabi ko, mas prone yung mga babae sa UTI kaysa sa mga lalaki kasi ang urethra ng babae is shorter than dun sa mga boys or sa mga males. Febrile infants younger than 2 months constitute an important subset of children who may present with fever without a localizing source. The workup of fever in these infants should always include evaluation for UTI.
Acute UTI are relatively common in children. Out of 10% by 7 years of age, 8% of them are girls and 2% of them are boys will have at least one episode. There are studies that states that infants presenting to pediatric emergency departments, the prevalence of UTI in infants younger than 60 days with temperature greater than 100.4 degree Fahrenheit or 38 degrees Celsius was 9%. Children also practicing habits that can lead to bacterial growth or urinary tract infection. And these are first, delaying trips to the bathroom or infrequent urinating or yung pagpipigil nila ng pag-ihi. Next is not emptying the bladder completely or hindi fully naiilabas yung urine na nakastore sa bladder. Next, infrequent bowel movements or constipation. Next is yung wiping back to front after using the toilet for girls, which is medically wrong dahil sa pagwa-wipe ng genitals, lalo na sa girls, dapat mag-start sa front to back. Next is ang poor water intake. Some children are simply prone to getting urinary tract infections even though they have a good habits or they are practicing a good lifestyle. But there are some cases or some instances that a child may have a defect where the ureter joins the bladder. It is causing the urine to flow backwards, and this is a condition or a medical condition called vesicoureteral reflux. This condition does not cause urinary tract infection, but when the bacteria get into the bladder, there is a greater chance of developing a kidney infection, which is associated with high fevers and can lead to kidney damage. These are the symptoms of urinary tract infections that can manifest on children. And most probably, young children will not be able to tell you what is wrong or cannot verbalize or explain what they are feeling. So, we need to look for the signs of UTI. And these are, first is the fussiness and irritability. Next is refusal to eat or walang gana kumain or ayaw kumain. Next is yung cloudy or foul smell ng urine. Next is yung blood in urine. Next is yung sign, this is a sign of uncomfortability ng bata, which is grabbing diaper when urinating. And next is fever, and lastly is vomiting. In older children, symptoms may include, first is burning with urinating, frequent urination or yung madalas na pag-ihi within the day. Next is cloudy, dark, or foul-smelling urine. Next is stomach ache, daytime or nighttime wetting, blood in urine, and lastly, fever and back stomach pain. For the diagnosis, urinary tract infection are diagnosed by obtaining a urine sample. Your child will need to obtain a clean urine sample which will be checked for bacteria or pus or white blood cells and then send it to lab for urine culture. For the prevention, there are several simple ways that can help to reduce and prevent the risk of your child to develop urinary tract infections, and this includes, first is, we need to encourage your child to drink plenty of water, which is helpful for us to avoid our urine to be concentrated, and empty the bladder on a timed, regular interval every 2 to 3 hours. Next is avoid the forces, caffeine, chocolate, citrus, and carbonation, because these products will worsen the UTI or the urinary tract infection. Next is avoid tight clothing and diapers. Next is keep the vaginal and anal area clean. We need to teach the girls to wipe from the front to back. And lastly is monitor and treat for constipation. Treatment. Treatment for urinary tract infections depends on the cause. Your doctor or the physician will be able to determine which organism is causing the infection from the test results used to confirm the diagnosis. So in most cases, the cause is bacteria. So UTIs caused by bacteria are treated with antibiotics. The most recommended initial antibiotics for most children with urinary tract infection is first, trimethoprim sulfamethoxazole, Bactrim septra, and there are also alternative antibiotics, and these include amoxicillin, clavulanate augmentin, or cephalosporins such as cefixime suprax, cefpodoxime, cefprozil, cefzil, or cephalexin Keflex. Those medications or those antibiotics kill bacteria. Kids or children usually take them for anywhere from 3 to 10 days, most commonly 7 to 10 days. Your doctor or your physician might do another urine test after your child finishes the medicine to see if the infection has cleared up. Next is nursing care plan, urinary tract infection in pediatrics. Let's start with the assessment. So for the subjective, umiiyak siya sa sakit habang naihi as verbalized by the mother. Objective, facial grimace, and we can assess or we can rate this through Wong-Baker Face Pain Rating Scales, and we have the scale of 0 to 10. 0 means no hurt, 2 hurts little bit, 4 hurts little more, 6 hurts even more, 8 hurts whole lot, and 10 hurts worst. Next is restlessness, and this is the need to constantly move or unable to calm or hindi mapakali. Last is temperature of 38 degrees Celsius, which is already febrile. So, for the nursing diagnosis, acute pain related to inflammation of urinary tract as evidenced by pain while urinating. So, for our planning, after 8 hours of nursing intervention, the client's pain will be relieved and controlled. Next is our outcome identification. Client will experience comfort and free from pain while urinating. Our nursing intervention, we have independent, assess client's description of pain, such as quality, nature, and severity of pain, which is, as I said a while ago, we can use the Wong-Baker Face. Next is encourage increase of fluid intake, 2 to 3 liters if contraindications. So, by drinking more fluids, this will help to flush any irritants through your bladder, and by drinking more fluids, it will help us to prevent our urine to be concentrated. Next is dependent. Instruct the parent of the client to avoid drinking sodas and eating salty foods. And these habits can also lead to bacterial growth and UTI. And specifically, we need to avoid the 4Cs or the caffeine, chocolate, citrus, or carbonation, because carbonated or caffeinated sodas are the culprits when it comes to worsening urinary tract infection. Next is collaborative. We need to administer antibacterial as prescribed. So, our evaluation, after 8 hours of nursing intervention, the client's pain was relieved and controlled. Goals was met. Next is the drugs or medications that we can give or we can administer to the clients that have urinary tract infection. First is the cephalexin Keflex, which is antibiotic. Name of the drug, brand name is Keflex and the generic name is cephalexin. And the mechanism of action, cephalexin, a beta-lactam antibiotic similar to penicillins, inhibits the third and final stage of bacterial cell wall synthesis by preferentially binding to specific penicillin binding proteins that are located inside the bacterial cell. Next is dosage, 3 to 17 years old, 25 to 50 mg per kilogram per day, and the maximum dosage is 100 mg per kilogram per day. So for the indications, genitourinary infections caused by E. coli, P. mirabilis, Klebsiella. So contraindications, antimicrobial resistance, viral infection. Cephalexin does not treat viral infection. Contraindicated for use in patients with cephalosporin hypersensitivity. And the adverse reaction of this drug, for the gastrointestinal, we can have diarrhea, abdominal pain, and nausea. Dermatologic is rash, and the central nervous system is dizziness and headache. The pharmacokinetics, cephalexin is administered orally, is distributed into most body tissues and fluids, but does not reach therapeutic level within the CSF. It crosses the placenta. So the nursing considerations, assessment of the history, penicillin or cephalosporin allergy, and for the physical, renal function test, respiratory status, skin status, culture, and sensitivity test of infected area. Next drug is cefixime Suprox, which also an alternative antibiotic for UTI. The name of the drug, brand name is Suprox and the generic name is cefixime. The mechanism of action, cefixime is semi-synthetic cephalosporin antibacterial drug. Dosage is 8 mg per kilogram per day, and this may be administered as single daily dose or may be given in 2 divided doses as 4 mg per kilogram per day every 12 hours. And for the indications, Suprox is indicated in the treatment of adults and pediatric patients 6 months of age or older with uncomplicated urinary tract infections. Contraindications: Suprox cefixime is contraindicated in patients with known allergy to cefixime or other cephalosporin. Adverse reaction is for gastrointestinal, and these are diarrhea and loss of frequent stools. And for pharmacokinetics, Suprox chewable tablets are bioequivalent to oral suspension. So for nursing considerations, assess for infections at beginning of and throughout therapy, obtain specimens for culture and sensitivity before initiating therapy, monitor signs of allergic reactions and anaphylaxis including pulmonary or skin reactions, and lastly, notify the physician or nursing staff immediately if these reactions occur. Lastly is the ibuprofen, and the name of the drug. The brand name is Advil and the generic name is ibuprofen. The mechanism of action reversibly inhibits cyclooxygenase 1 and 2 enzymes, which results in decreased formation of prostaglandins precursors, has antipyretic, analgesic, and anti-inflammatory properties. The dosage is 4 to 10 mg per kilogram per dose per RM every 6 to 8 hours. Maximum single dose is 400 mg per dose and maximum daily dose is 40 mg per kilogram per day up to 1,200 mg per day. Indications: ibuprofen temporarily relieves minor aches and pains. It is a non-steroidal anti-inflammatory drug and fever reduction. Contraindications: hypersensitivity to ibuprofen or any component of the formulation, history of asthma, urticaria or allergic type reaction to aspirin or other non-steroidal anti-inflammatory drugs, aspirin triad used in setting of coronary artery bypass graft surgery. The adverse reactions: hematologic, decreased hemoglobin, and the hepatic, increased serum alanine aminotransferase and increased serum aspartate aminotransferase. The pharmacokinetics: onset of action oral, analgesic within 30 to 60 minutes, antipyretic single oral dose 8 mg per kilogram. Nursing considerations: assessment, history, allergy to ibuprofen, salicylates or other non-steroidal anti-inflammatory drug, CV dysfunction, hypertension, peptic ulceration, gastrointestinal bleeding, impaired hepatic or renal function. And for the physical: skin color, lesions, orientation, reflexes, ophthalmologic, evaluation, odometric evaluation, peripheral sensation.